So lately, I've had more people complain that they're doing more sitting and their back is getting more aggravated. And it's not uncommon, especially now, because we're sitting now more than ever. No study came out that said we're sitting for 12 hours a day. And it's very common that when you sit that long that you're going to aggravate your back, because sitting absolutely is the leading cause of back pain, but it's also the cause of 3.2 million deaths per year from lack of physical activity or inactivity, which is really the result of too much sitting. So it's bad for your back, but it's bad for your heart, it's bad for your lungs, it's bad for your blood flow, it's bad for your brain. So we have to create some habits to help sort of break up all this sitting that we're doing. And it's really simple. And there are 7 things that you can do every day throughout the day to make sure that your back pain is not getting aggravated from your sitting. One thing that we know is the disc functions best when the stresses are distributed evenly in all directions around the annulus. So top of the disc is there. When the stresses are distributed evenly, it's all around the annulus in a way that the load is not in one position. It's all over the disc. But what happens is when we sit, sitting puts us into flexion. And flexion is where the spine goes forward. And what happens is all these ligaments start to stretch out. It's called ligamentous creep. And this stretching of the ligaments and the overflexion of the spine will aggravate the disc, and then the disc will start to push back. And as it starts to push back, it'll stress the annulus, and the annulus will get aggravated, irritated, and the longer it gets aggravated, irritated, and inflamed, it'll start to tear. Inflamed tissues get weaker, and you'll develop a little tearing of the annulus, and the disc will bulge. And then it will start to herniate slowly over time. There are very specific positions that are best for sitting. When you sit in a position where you're leaning back a little bit, which is about 110 degrees, 90 would be sort of straight up and down, 110 is where you're leaning back. That is the least amount of stress on the spine in the seated position. The least amount of stress on the spine in any position is laying down. But in the seated position, because we're sitting for so long, you want to be in a position where you're leaning back just a little bit. Because at 90 degrees, you're going to add 140 pounds of pressure to the disc. At 80 degrees, where you're actually flexed forward, you're like double flexion, because the very process of sitting causes that part of the spine to flatten out, and then you're leaning forward. That's really putting a lot of load on the back and load on the disc, causing the disc to push out and causing the ligaments to creep. And then if you have to hold something while you're sitting, which doesn't happen very long, but if you bend over to pick something up, you're really overloading the disc to almost 300 pounds of pressure. So it's really, really, really tragic if you have to sit for 12 hours a day without moving around, because that's when you start to develop lots of trouble. So when you sit, all the ligaments start to stretch out. So one of the things that we need to do is try to avoid overstretching for too long. And the way we do that is we break up our sitting every hour to avoid that the compression on the annulus, which forces the nucleus out. So every hour, you're going to do very specific things. If you can work for 55 minutes uninterrupted, then you need to take a 5-minute break. Matter of fact, the limits to most people's ability to focus on one topic for any amount of time is 55 minutes. So every 55 minutes, you're going to take a little break. This is good for you. It's good for your brain. It's good for everything. Every 30 minutes, you're going to sit in the chair. You're going to do the chair stretch. You're going to scoot to the edge of the chair. You're going to drop your arms down. You're going to rotate your shoulders back, and it's going to put your spine into a position where you're unloading the disc and allowing the ligaments to slowly go back to what is considered normal. You're going to do that every 30 minutes, and every hour you're going to get out of the chair. You're going to look up as you get up out of the chair, and you're going to get out of the chair properly. There's a right way and a wrong way. And then when you get up, you're going to walk around for 2 minutes. That's the goal, to help slowly start to put the ligaments back into a better position. Every 15 minutes when you're in the chair, you're going to do a little bracing. You're going to activate your core, activate your core, activate your core. Do it every 15 minutes. Do it 10 times. It's easy. It doesn't hurt. It's not going to interrupt your ability to do your job. Really simple. If you get in the habit of bracing more throughout the day without having to think about it, as you know, you're not lifting heavy weights, you're just contracting your core. That'll help. Number 5 is you're going to rest. And like I said earlier, the least loaded position of the spine and the discs is lying down. Some of you are going to function better on your stomach. Some of you are going to be better on your back. Most people that have their back pain aggravated from the seating position need to stretch on your stomach. Some of you, maybe 20% that are really aggravated with the disc in the seated position, you're going to want to lay on your back. Okay? You have to identify what position you are by identifying what bias you are. We talk more about bias in the relief routine and in the 10X program. And then you're going to do, every 2 hours, you're going to do your core activity for your bias. So every hour, you're going to get up and walk around, and then every 2 hours, you're going to either lay on the floor and do your flexion exercises, or on your hands and knees and do your extension exercises. But don't do both. Some of you do both, but you're going to pick the one that's best for you, and you're going to do that. And number 7, you need to make sure when you're seated for that 55 minutes that you're in the best position for your spine. Again, that's 110 degrees. It's not 90, it's 110, and that will slowly start to unload the disc. We live in an environment where we're sitting more because of the virus. So as we do this, break up your routine. This program works. It's going to help you feel better. So take a look. If you need to make some notes on that, make some notes on that. But it's 7 steps throughout the day to help you get your life back.